Hello, my name is Cesar Manrique. My topic present is brain metastasis. Definition: brain metastasis occur with cancer cells spread from their original location to the brain. Any topic of cancer can reach the brain, but those most likely to cause brain metastasis are lung cancer, breast cancer, colon cancer, kidney cancer, and melanoma.
There are different kinds of brain tumors. It's important to discriminate between primary brain cancer, which is a tumor that's born in the brain, and that's actually pretty rare. And then there's metastatic brain cancer, which is 5 times more common. Part of what makes cancer cancer is that it has the ability to spread throughout the body. So the tumor might start in the breast and it gets to a certain size and it develops some mutations, and then the cell will split off, get into the blood, and then stop somewhere in the brain and deposit inside the brain and form other tumors. And that would be the process of metastasizing.
There is a blood-brain barrier, and that barrier works very well at keeping toxins and infections and other things floating around through our blood out of the brain. But cancer has developed a mechanism which it can penetrate that barrier, and certain cancers in particular are better at penetrating it than others, which is why we tend to see most metastatic tumors from lung cancer, breast cancer, melanoma, and testicular cancer. If you remove one of these metastatic tumors from the brain with surgery and you look at it under a microscope, it looks like the cancer from the original source. So a breast cancer metastasis looks like abnormal breast tissue rather than brain tissue. They're growing into a ball of cells that is the cancer, but they're not incorporating themselves into the brain. They're unwanted neighbors, if you will.
Our goal is to find those tumors early, because as the tumors get bigger, the success rates drop. Typically, with radiosurgery, people have quoted success rates at stopping a brain tumor in the range of 85%. So when we say, how do we get that to 95%, to 98%, to 99%, it's with identifying the tumors earlier. And that means getting a periodic brain scan to check, because missing a brain tumor, if it grows, can cause neurologic symptoms that we'd like to avoid.
Application in nursing. Radiotherapy is one of the mainstays of the treatment of all oncology patients. The field of administration of radiotherapy, including the tumoral volume, the lymph node, pandering, the iron and the healthy tissues updated to the tumor. For this reason, the effect of radiotherapy also appears in healthy tissues and are more marked. It does with the heat cell tumor rate, such as the oral, pharyngeal, and laryngeal, mucous, and bone marrow. The present article aims to review the positive effect of radiotherapy on healthy tissues in the treatment of head and neck cancer and propose measures to prevent or reduce toxicity aspects relative to nursing care and treatment measures for the local adverse effects of radiotherapy are also discussed. Pros and cons. Pros. Treatment of for people with brain metastasis include medication, surgery, steroid radiosurgery, whole brain radiotherapy therapy, or the mixture of these. In certain situations, the treatment team may consider drug treatment for brain metastasis. Cons. As metastatic brain tumor increases in size, the path present on the surrounding brain tissues and chance its fusion. The causing symptoms such as healthy personnel change, memory loss, and sizes. Issues applicate and Ecuador. Retrospective study carried out of the Salmo Espinosa Ayala Hospital Socal Quito, patients with brain metastasis treated with holoencephal radiotherapy in the periodic from January 2003 to December 2018, were resin for cervical analysis capable measure course and significance of difference with the long-run test were used with um, 5% tie or alpha error and addition. A varied analysis was performed with the code logis realistic model bit with the medial surgical and the variable Karnofsky Eden egg number of brain metastases, extracranial metastasis, primary tumor, and the Gleason prognostic access scale. Conclusion: Brain metastasis occur with cancer vein in another part of the body and spread. Metastasis to the brain. Brain metastasis occur with cancer cell spread from the original location to the brain.
Now, with our modern imaging technology, where we can see really, really small tumors inside the brain, we can actually now avoid whole brain radiation altogether and treat those tumors with radiosurgery.
Stereotactic radiosurgery is a technique of delivering radiation very specifically to a target inside the head.
The concept here is you're destroying tumors inside the body with, frankly, the accuracy of a blade of a knife. You're destroying a tumor deep inside the body, almost like cutting it out, but you're using a non-invasive way. The radiosurgery devices are usually accurate to about a millimeter, and about a millimeter is about how accurately we can pick out where the tumor is anyways on the MRI or CT scan. So that's about as accurate as they need to be.
It uses multiple beams of radiation that all converge on a single point. What I tell patients is this is very analogous to taking a magnifying glass and a leaf. And if you hold a leaf out into the sun, it won't spontaneously combust and catch on fire. But if you take a lens and focus that low-dose sun power down on a point, it'll burn a hole in the leaf. And so that's, in its essence, what stereotactic radiosurgery machines do.
The radiation's coming from all these directions and it's being concentrated in that one spot. But around that spot, there's not a lot of radiation, so the damage is really focused on the tumor.
Brain metastases are one of the few targets that we treat in the brain that can absolutely disappear with radiation. The tremendous advantage of radiosurgery is it does not interrupt systemic treatment, whereas that's undergoing standard whole brain radiation must suspend standard treatment.
Thank you.